Welcome to Sports Injury Podcast, Episode 7. My name is Josh Ryder. I'd like to talk to you guys today about quad strengthening progression for rehabilitation. I'm going to talk in general terms today, not specific to any one diagnosis. So when I'm rehabbing a knee, typically I'm going to start off real simple with something at the isometric level. So we would typically start out with some quad sets. My next progression would be to a straight leg raise exercise. So now we're working isometrically at the knee, but isotonically at the hip. My next progression will be to a TKE exercise, which stands for terminal knee extension. Typically I do that against a TheraBand resistance. I like the TKE exercise because it allows me to work isotonically at the knee without having to worry about squatting mechanics. The next phase is getting into some squatting. So if I'm working with an athlete, that'll be a partial squat exercise. If it's a non-athlete, I'll go to a sit-to-stand instead, just because that sit-to-stand exercise is a little bit easier for them to grasp. That partial squat or sit-to-stand that I was talking about would be done with body weight. If I want to work above or below the patient's body weight, what I would do is I would go to a leg press machine. So that leg press option is available if needed. The next progression would be to a lateral step-down exercise. The lateral step-down exercise is going to give me a good idea of where the patient's eccentric quad strength is at. If I feel that the patient needs additional eccentric quad strengthening at this time, I'll add in an eccentric leg press to supplement. And that means I'm pushing out with both legs on the leg press and then lowering back down with the affected leg. But going back to the lateral step down exercise gives me a good idea of where the athlete is at. In fact, if I'm working with an athlete after ACL reconstruction, if they can't control at least a 6-inch lateral step down with strict technique, I won't let them run yet, even if they're cleared by their doctor, just because I don't think it's safe. And once I see the athlete able to complete an 8-inch lateral step down with strict technique, then I know that they're doing really good. At that point, I know that the athlete is ready for some more advanced exercise activities. These might include a walking lunge with trunk rotation, or a single leg squat, or a single leg reach matrix for dynamic balance. What I want to conclude with is my suggestion to have a clinical rationale for your progression. You should be looking at things like pain, strength level, and how they're doing on their existing quad exercises to guide you. Remember that you can skip a step within the progression that I outlined, but just make sure that you have a clinical rationale for doing so. Where I often see therapists getting into trouble is that they skip multiple steps with no clinical rationale for doing so. For example, I'll see a therapist working with someone with patellofemoral pain, and they'll be doing some quad sets to start and just trying to calm the pain down, and then they'll immediately skip to lateral step downs and lunges and flare the patient back up. So I think that as long as you're smart about the athlete's progression, they're going to have a good outcome.